Running a healthcare practice requires you to do two conflicting jobs at once. You have the clinical side, focused entirely on patient care, and the administrative side, managing an endless influx of calls, intake forms, and billing tasks. Most practice owners find that sourcing new people for the front desk is manageable. The friction point is keeping them in the seat. This chart illustrates the baseline reality for independent practices. Documented MGMA data shows that front office support staff operate with a 40% turnover rate. The instability bleeds into the back office too. Business operations and billing staff turnover sits right alongside it at 33%. These figures reflect the consistent norm current to 2025. This is the environment you are competing in. When an experienced front desk coordinator leaves, patients notice immediately. They wait longer on hold, leave voicemails that take days to return, and interact with staff who do not know their medical history or preferred scheduling rules. Inside the office, the remaining team absorbs the vacant workload. They push harder to cover the gaps, accelerate their own burnout, and eventually they hand in their formal notice. Continuing to feed this cycle through traditional local hiring creates a permanent state of onboarding, ensuring constant instability where your patients interact with you first. The financial drain of replacing a single frontline support staff member runs anywhere from $25,000 to $30,000. This waterfall chart breaks down that estimate. It factors in external recruiting fees, the drop in productivity during the vacancy, hours spent training the new hire, and the performance gap while they get up to speed. Looking at the daily operating costs, a qualified local coordinator or billing administrator requires a fully loaded rate of $28 to $40 per hour, covering base salary, payroll taxes, benefits, and paid time off. Multiply that by 2 full-time employees, and your practice carries over $116,000 in annual overhead before purchasing a single computer or phone line. The operational tax is equally severe. Practices managing high turnover experience a measurable 10% decline in patient satisfaction scores. Inexperienced staff also make more frequent data entry and coding errors, which show up weeks later as delays in your accounts receivable. Hiring a direct replacement fixes the immediate vacancy, but leaves the underlying structure identical. The clock simply restarts. When administrative coverage drops, specific, critical workflows degrade within hours. If the front desk is short-staffed during peak volume, calls go straight to voicemail. For a new patient trying to book their first appointment, a missed call usually means they dial the clinic down the street. Then there is the verification bottleneck. Insurance verification and prior authorizations consume massive amounts of front-end hours. As experienced staff leave, newer team members take over these tasks. They navigate payer rules slower and miss required steps, generating claims that payers eventually reject. This line graph traces the upward trajectory of those rejections across the industry. Initial claim denials reached 11.8% in 2024, squeezing practice margins tighter than prior years. Correcting this takes time. Standardizing EHR workflows and communication rules requires months of direct supervision that most independent practices cannot provide. Every resignation deletes hard-earned institutional knowledge from your building.
The next hire starts from zero. Leaving these administrative vulnerabilities open forces your clinical staff to step in and clear the backlog, pulling them away from direct patient care. Practice management data points to a clear structural fix. Isolate clinical responsibilities from your administrative load. By outsourcing repeatable, high-volume back-end tasks, you protect your local in-house team, allowing them to focus exclusively on patient-facing relationships. The hesitation most practice owners have is integration. The assumption is that a remote team will mismanage the workflows and create more chaos than they solve. There's a massive difference between a generic offshore call center and a specialized service like Staffingly, which deploys healthcare-trained professionals to map to your protocols. Their virtual teams include medical doctors, certified pharmacy doctors, and U.S.-licensed registered nurses, ensuring your backend is managed by people who already understand medical terminology and operations. Practice administrators who have made the switch are highly specific in their feedback. One verified Trustpilot review calls Staffingly far and away the best outsourced solution they have used. That same review explicitly praises the smooth onboarding. This validates that a structured, remote integration can execute without disrupting daily patient flow. Relying entirely on staff you can physically see in the office is an outdated comfort.
Transitioning to a rigorously trained, specialized remote team provides the reliability required to maintain operations. The onboarding process takes roughly 2 weeks. In that time, the Staffingly team internalizes your specific EHR platform and scheduling rules. They establish a compliant infrastructure immediately. Every team member works through a HIPAA-secure VPN under signed business associate agreements, backed by SOC 2 Type 2 and HI Trust certifications. Once deployed, they handle the entire intake pipeline, taking over call management, patient intake and registration, and daily EHR documentation. Look at this workflow diagram to see how they protect your revenue. Before any claim is submitted, Staffingly deploys an AI tool layer that intercepts the documentation to check for modifier errors or coding mismatches. These AI tools are trained on specific denial patterns, catching authorization gaps and fixing them before the claim ever leaves your system. This combination of analytics and human review hits a 97 to 98% target accuracy rate, yielding up to 40% fewer denials on the first pass. Pairing deep medical expertise with AI-assisted review builds an administrative engine that consistently outperforms a stretched local front desk. This scale lays out the final financial reality. Your fully loaded in-house hourly rate sits between $28 and $40. A dedicated professional through Staffingly starts at $8 to $10 per hour. That is a direct 70% cost savings per full-time equivalent, returning tens of thousands of dollars to your operational budget. You can test this model through a 2-week risk-free pilot program. There are no long-term contracts, giving you month-to-month flexibility. You can continue struggling to hire and replace expensive local administrative staff, or you can integrate a structured virtual partnership that